Section 1. The Universe Within. Unraveling the Enigma of Angelman Syndrome. Imagine a vast universe filled with billions of galaxies, each containing billions of stars. Now picture a single star, unique and extraordinary. That star is Angelman Syndrome, a rare genetic disorder affecting approximately 1 in 12,000 to 20,000 live births worldwide. This condition, often misdiagnosed as autism or cerebral palsy, presents a unique set of challenges and triumphs. Join us as we journey into the universe within, exploring the intricacies of Angelman Syndrome, its impact on individuals and families, and the importance of understanding and supporting this remarkable community. This essay seeks to illuminate the often misunderstood world of Angelman Syndrome. We will delve into its causes, explore its diverse manifestations, and celebrate the resilience of those it touches. We will also examine the importance of early intervention, the power of community, and the ongoing quest for effective treatments. Our journey begins with a fundamental understanding of Angelman Syndrome. This complex neurogenetic disorder primarily affects the nervous system, impacting development, communication, and behavior. While every individual with Angelman Syndrome is unique, certain hallmark characteristics define this condition. By understanding Angelman Syndrome, we expand our own understanding of the human experience. We learn to appreciate diversity, embrace differences, and celebrate the unique journeys of those around us. Let us embark on this journey of discovery together. Section 2. A rare star in our galaxy. Understanding the basics. Angelman syndrome is a genetic disorder, meaning it is caused by an alteration in an individual's DNA. This alteration disrupts the function of a gene called UBE3A, located on chromosome 15. This gene plays a crucial role in the development and function of the nervous system. The UBE3A gene provides instructions for creating a protein essential for normal brain development. In most cases, we inherit one copy of this gene from our mother and one from our father. Both copies are active in most of our bodies. However, in a specific region of the brain, only the maternal copy of the UBE3A gene is typically active. In individuals with Angelman syndrome, the maternal copy of the UBE3A gene is either missing or not functioning correctly. This lack of functional UBE3A protein disrupts the delicate balance of brain development, leading to the various characteristics associated with the syndrome. The absence or malfunction of the UBE3A gene can occur due to several different genetic mechanisms, each with its own implications. Understanding these mechanisms is crucial for accurate diagnosis, genetic counseling, and potential future therapies.
Section 3. The Cosmic Blueprint, Genetics and Angelman Syndrome. The most common genetic cause of Angelman syndrome is a deletion in the maternal copy of chromosome 15. This deletion, encompassing the UBE3A gene, occurs in approximately 70% of individuals with the syndrome. Another cause is a mutation in the UBE3A gene itself. These mutations can alter the gene's structure or function, rendering it incapable of producing the necessary protein. Mutations account for about 10% of Angelman syndrome cases. In a smaller percentage of cases, Angelman syndrome arises from uniparental disomy, a rare genetic phenomenon. In this scenario, an individual inherits both copies of chromosome 15 from their father, instead of one from each parent. As the paternal copy of the UBE3A gene is typically silenced in the relevant brain region, individuals with uniparental disomy lack a functional copy of the gene. Finally, a small number of cases involve imprinting defects. Imprinting refers to a process where certain genes are marked or silenced depending on whether they are inherited from the mother or father. In Angelman syndrome, imprinting defects can prevent the maternal copy of the UBE3A gene from being activated, leading to the characteristic symptoms. Identifying the specific genetic mechanism underlying each case of Angelman syndrome is crucial for understanding the individual's prognosis, providing accurate genetic counseling to families, and exploring potential targeted therapies.
Section 4. Echoes in the silence, communication, and Angelman syndrome. One of the most prominent characteristics of Angelman syndrome is its impact on communication. Individuals with the syndrome often have limited or absent speech, making it challenging to express their needs, thoughts, and emotions.
While verbal communication may be limited, individuals with Angelman syndrome are incredibly expressive, and use a variety of nonverbal communication methods. They may use gestures, facial expressions, body language, and assistive communication devices to interact with the world around them. Early intervention with speech and language therapy is essential for individuals with Angelman syndrome. These therapies focus on maximizing their communication potential, teaching them alternative communication methods, and supporting their understanding of language. Augmentative and alternative communication devices, such as picture cards, communication boards, and speech-generating devices, can be invaluable tools for individuals with Angelman syndrome. These devices empower them to express themselves, engage in meaningful interactions, and participate more fully in their communities.
Section 5. A different path, a different pace. Developmental milestones. Angelman syndrome also affects the pace and pattern of development. Children with the syndrome typically experience developmental delays, particularly in areas related to motor skills, language, and cognitive abilities. Motor delays may manifest as difficulty with balance, coordination, and fine motor skills. Children with Angelman syndrome may start walking later than their peers and may have an unsteady gait. Cognitive development, including problem-solving, reasoning, and memory, may also be affected. Individuals with Angelman syndrome often have intellectual disabilities, but their learning potential should never be underestimated. Despite these challenges, individuals with Angelman syndrome continue to learn and grow throughout their lives. With appropriate support, therapy, and educational interventions, they can achieve their full potential and live fulfilling lives. Section 6. Recognizing the constellation symptoms and diagnosis. Diagnosing Angelman syndrome can be challenging, as its symptoms can overlap with other developmental disorders. Early recognition is crucial for ensuring individuals receive the appropriate support and interventions. In infancy, signs of Angelman syndrome may include developmental delays, feeding difficulties, and a happy, excitable demeanor with frequent laughter or smiling.
As children grow, characteristic features may become more apparent, such as a distinctive facial appearance, microcephaly, which is a small head size, seizures, and ataxia, which are balance and coordination problems. A diagnosis of Angelman syndrome is typically confirmed through genetic testing, which analyzes an individual's DNA to identify abnormalities in the UBE3A gene or chromosome 15. If you suspect your child may have Angelman syndrome, it is essential to consult with a healthcare professional. Early diagnosis and intervention are critical for maximizing outcomes and supporting the child's development.
Section 7. The power of early intervention, guiding stars. Early intervention plays a pivotal role in the lives of individuals with Angelman syndrome. Starting therapies and interventions as early as possible can significantly impact their development, communication, and overall well-being. Early intervention programs typically involve a multidisciplinary team of professionals, including developmental pediatricians, speech and language therapists, occupational therapists, and physical therapists. These specialists work collaboratively with families to develop individualized intervention plans tailored to the child's specific needs and strengths. They provide ongoing support, education, and resources to empower families to navigate the challenges and celebrate the triumphs of raising a child with Angelman syndrome. The benefits of early intervention are far-reaching. It can enhance communication skills, improve motor abilities, promote cognitive development, and foster social-emotional well-being. Early intervention also provides invaluable support to families, equipping them with the knowledge, skills, and resources to advocate for their child's needs.
Section 8. A tapestry of support therapies and interventions. Throughout their lives, individuals with Angelman syndrome benefit from a range of therapies and interventions designed to address their unique needs and promote their independence.
Speech and language therapy remains crucial throughout their lives, focusing on maximizing communication skills, exploring alternative communication methods, and supporting language comprehension. Occupational therapy addresses challenges with fine motor skills, coordination, and daily living activities. Therapists work with individuals to develop strategies for independence in self-care, play, and school-related tasks. Physical therapy focuses on improving gross motor skills, balance, and coordination. Therapists may use a variety of techniques, such as exercises, assistive devices, and adaptive equipment, to enhance mobility and functional independence. Behavioral therapy can be beneficial in addressing challenging behaviors, such as hyperactivity, sleep disturbances, and attention difficulties. Therapists work with individuals and their families to develop strategies for managing these behaviors and promoting positive interactions.